exit in the entry point, and we'll search the track because there is a minimal fibrosis. This is why we have a minimal fibrosis, because the track doesn't move. It's fixed, moves just in a wet tissue, but not usually. So we have a minimal fibrosis. And the versatility of this technique we can use with lipofilling, liposuction, medial platysmal raphia, removal of redundant skin with microlifting, and as I showed you before, with superficial energy treatments or other medical procedures. In Europe, we do a mini lifting academy in which we perform in cadaver lab these maneuvers twice in a year in Italy and Barcelona. Thank you.
Thank you, Dr. Mika. Now you can go through presentation from Dr. Mika. Every question if you want to ask, otherwise we can wait here for after that we can do. Doctor.
Excellent, Dr. Lucas. Myself, Vikram Singh Rathore. So I have a couple of questions or rather say clarification. When do you decide in a neck the central band, platysmal band need to be severe?
Severe?
You cut. When you decide the central platysmal band to be cut. Otherwise, you said the entire thread should be underneath the lateral as well as the central band.
Okay, the first question, then you repeat. Now I decide to cut always the medial platysmal band now, because I'm comfortable with the closed technique, with the silk. As I said before, I cut 0.5 centimeter under the prevented cervical mandibular line. So, for example, if this is my cervical mandibular line, I cut just 0.5 centimeter under, okay? My predicted cervical mandibular line, because it will be. And then when I have cut, I perform the lifting and I pull.
I got it, because that was my question. Because what happens if we are not removing the neck band, central neck band, ultimately the longevity of the result doesn't remain. So that's why you said now you are following a policy to cut in each and every case.
Yes.
However, second question is that if suppose a complication happens, you want to remove the thread. So from the entry point for the temple, it's easy to remove. But for the neck, since you are creating another opening, does it create a problem to remove the thread?
Yeah. For the neck, right question. For the neck, before you have to cut in the crossing point, and to cut the crossing point, obviously. After that, you start from the entry point that are in the study. Yeah. Okay.
Thank you.
Yeah. Well.
Thank you.
I just like 30 minutes ago. I saw something. It was take me to the shop. So I go, this is the shoes, everything. I was like in a sweatshirt, you know. Yeah. So okay. Yes, I get it. And so, and so you can share people with ask questions, but it's better to understand to answer. Because you know sometimes they ask questions and they can look at it. Yeah, it was crazy.
Can I
Keep it. What was the
really price?
आयुर्वेदिक फोटो बनले ना सबके लेते रहना हमारे मतलब now you connect to सुबह का जो उठाना टेबल लगना Okay.
ऐसा वो अपना बैठ जाएंगे ऐसा मुझे आशा है इसमें बैठ जाएंगे
यहाँ पर और एक चेयर डाल
हाँ जा रहा हूँ शेयर ही लगाने। हाँ हाँ वो तो कर देता हूँ, करते जा रहा हूँ।
Very good morning. Good afternoon to everyone. Good afternoon to everyone. And for all those of you who don't know me, my name is Amit, and I am from Delhi. So I'll just tell you very simple, small things, the differences that we see in India. I've been doing these threads for about a year and a half. So I was fortunate enough to travel to Nice in August 2024, and we learned this technique. And it is privilege as well that the gentleman who I learned it from, his son is also here, so he's going to be talking to us. It's a wonderful team, great hospitality, and more important, great knowledge of a concept that was very foreign to me. And I'll make a very simple statement here which should raise some bells in your minds as well. So all of us know how to do the other kinds of threads. And plastic surgeons, ego thodi zyada hoti hai, we all know. So when the threads were being done, I was like, kid stuff. I'm 20 years, really nothing in it. So he said, okay, scrub and come. So to put 2 threads, it took me over an hour. And by the end of it, I was sweating. My shirt was all wet with sweat because of the stress, the tension, and the fact that this is not easy. So that should ring bells for everyone here. Having said that, when I came back, when I did my first case, it took me 2.5 hours. And my team saw me trembling for the first time. My hands were trembling because it is not easy. To be honest, it is not. By the 4th or the 5th case, we cut down the surgery time to about an hour, 15 minutes. Today we do it in about 25 to 30 minutes. But so of course it gets easy like all other surgeries. So the most important point that everyone must acknowledge today is it is very different from the other kinds of threads that we've been used to do. So you have to do a lot of unlearning and relearning. Otherwise, you will land up with problems. Why? Most of the other threads we are doing are subdermal. So we're used to that kind of a resistance-free zone. These threads, right from the outset, are deeper subsmas. And especially as you go down, you hit the zygomatic bone, you have to step down. Now, how do you step down? The needle is a semicircle. It's a C-shaped needle. You have to manipulate the needle inside the face, making sure you don't go intraoral as well. It is very easy to go intraoral, and that is why it is recommended that we do not give intraorbital blocks. If you do that, you will numb the patient. The needle can go intraoral. You will never know, and you will only know next morning when the patient says he or she can feel something. So that is little difficult. And then the barbs are, if you land up with a wrinkle, God forbid, you land up with a wrinkle, you have no option but to take a thread. It's not an absorbable thread. So there are ways to prevent that wrinkling, and I will just make 3 humble requests to everyone who wants to do these threads. Forget everything else, just three small things. One, stay deep. If you're more deep, you're likely to be safer. Second, learn how to exit the needle. You make one mistake and you will say, oh God, why was I born? It can be bad. And the third is the hair, which you saw how the hair was being cut. I don't cut hair, sometimes I do, sometimes I don't. But management of hair, because I've done 51 cases till now. And amongst that 51 is my mother as well. She's 76. And I've done her procedure as well. So it is safe. So that any patient who asks me, is it safe? I say, okay, talk to my mom, this is a no. So the patient does not ask whether it is safe. So hair management is the key. I've had one infection. I have no qualms about accepting my problems. So I generally do 8 threads in most patients. One thread got infected. We had to take it out. 3, 4, and like we do for breast implants, take it out, let the tissue rest, antibiotics, etc., and then go back and put that. So it's not tough. The problem was we identified was hair. What you will learn as you keep doing this is if you've got a transected hair inside, it does not matter, it will get dissolved. But if you've got a living hair inside, if it is still attached to a root, it will keep growing and cause a mess. Like a breast implant, the first evidence of infection, please do not depend on antibiotics and heat compression and God and all that stuff doesn't work in this. No God will come to help you. The first evidence of infection, please take the thread out. Just remember these 3 things, you will be safe because surgery you will eventually done. It is very simple because we are all plastic surgeons. And I think sometimes people ask me, is it really, should we do it? Why don't we just open and do it? Or why don't we keep using what we have? Please remember, these threads are only for plastic surgeons. So we have extreme exclusivity over these threads. The company has a policy, they will not train, they will not give. So no non-plastic surgeon can get access to these threads. And that is a huge bonus for us. Now the reason for that is these are tough to do. And there's a certain bit of anatomy one needs to know. Now I myself do not even know the names of the fat pads on the face. I'll be very, very honest here. I'm not that educated in terms of anatomical names. But I do know what comes with. I have that touch sensation which we all do. So it's okay if you do not know nitty-gritty of each damn final nerve which grows there, but you should know what is there. That's all that we do. So I don't need to talk anything about these things. You already know this. What I'll just see. So in the Indian scenario, some of the problems, some people ask me a few things and I'll just talk about that. One, cost is an issue. It's a huge issue in India. We do not have the privilege of doing as many threads as we like. Patients do not pay. These are expensive. The maximum I have done on a patient is 6 and I've only done 2 such patients. In general, they do not even pay for 4 threads, 4 each side. So 8 threads. It gets really tough because, I mean, an average procedure like this will cost about 3 lakhs. That's what I price it at. You may choose to price it at whatever you like. Someone might charge 5, someone might charge 1. That's your choice. We price it at around 3.5 lakhs. Now, when we tell them, okay, we also need to do a bit of fat injection. Doctor, the cost is going high. Please include the cost. We tell them, okay, do a bit of face liposuction because Indian faces are heavy. We know that. In a heavy face, these threads do not work very well. I've had a bad, there was someone I knew very well, someone there known, and I made the mistake of not putting enough threads. Heavy face, unfortunately, she didn't get a good result. So it's my fault. But in a heavy face, my policy has now become I will do a laser on the face, I liposuck the face, I liposuck the neck, and then I'll pull. So that's what has become, and even if you have to do a buccal pad or something, it can easily be done at the same time. So we routinely do blepharoplasties, fat injections along with threads, face liposuctions. I'll show you a picture of one such gentleman. It's very safe in men. In my experience, which is very limited, I do not know if keloid patients can be done or not. We'll have to talk with the founders if patients are prone to, because the needle is coming out from 4 points on the face. 4 points here, this is hidden, and 4 points here. The problem are these. So I do not know. Now, the reason I do not know, when you do other absorbable threads, it makes no difference. The problem here is a bit of friction which happens because you're pulling the needle and the thread. Does that friction lead to keloids? I do not know. So let's just wait for the data. Now, I'm not getting into how temp threads and permanent threads are good or bad. The main focus here is the per or permanent, these threads are done sub-smart. So all those of you who do facelifts, simple corollary, can you do a facelift without smarts? Can you just do a mini facelift? How long does it last? So that is the answer whether temp threads are good or permanent threads. Now, we do have a patient who I'm going to be doing a live on. I'll make a disclaimer here. Today morning, so she's a gynecologist. She's coming from down south. She messaged me at 5:30 in the morning. I'm having doubts whether I want to do it or not. So I hope the plan doesn't change. I apologize in advance if the patient cancels out. It's not in my hand. I've tried to convince her. She has flown. She's already landed. She's at the hospital. But she's saying I have to consult you. So fingers crossed, let's hope everything goes well. So she says I only want to do one thread in the neck. I said please don't do it. There's no point to do it because we all know without the face there's nothing on it. So I'm not getting into this yet. This is the gentleman who had done a face liposuction, neck liposuction, and 8 threads, 4 each on the face, and buccal fat on the same day. So now we all know if I had not done the face liposuction, this is such a heavy face. The threads will not work. As simple as that. So if your patient says, no, I don't have the money, please don't do the patient because the patient will get really upset and then they'll call me. So I am on social media as being the first person. So when your patient gets upset, mark my words, they will call. Because then they go to social media, they'll start searching who did it, they'll find out. So please do not do a case if you feel they will not get a good result. Very simple. Very recently, so we had been saying no. See, I'll be honest, I do not have that much of experience in face plastic surgeries as some of our European plastic surgeons do. We do not get that many surgeries. So we were saying no to a lot of patients who had excess of skin. And those huge necks, and it's amazing the kind of results. I mean, I've been doing it, but I'm amazed at the kind of results shown in the morning with the neck. I truly believe those results surpass surgery as well because of the longevity without an incision. So you balance the two. Are you okay with the incisions, all that swelling, and are you okay with virtually no scar? Even if it's 20% less of a result, I would happily go for that. Once I get old, I don't want a cut on my face. I'd be happy with 20% less results. So if you are in doubt, don't do it. So what we've also started doing now is last week we had 2 patients, we did mini facelift along with threads. So that was also a test that does the thread really go deep. So when we opened the face, we couldn't see the threads. So that, and I took his help. I messaged him and he guided me. Do this, and that's exactly how it is. So people who have excess of skin, so 55, 60, 65, I think you can do threads because the smarts gets folded vertically and then just chop out the extra amount of skin. So it works there as well. So this is a lady again. So she's not Indian. This guy is of course Indian. So I'm trying to focus on what we've been doing. This is the next day of surgery, which we expect. So 4 threads. What you will always see, one more thing, there's a difference between dimples which you can remove and the dimples which you cannot remove. Sometimes we will get dimples at the exit. It just takes 5 seconds to remove them. And even if you've forgotten to do that on the day of the surgery, it's okay. Please mark one more point. No patient should be sent outside the city that same day. They have to be with you. You have to see them next day. Because if there's any dimple, you can release them. Because if they go back with that dimple, you are the worst villain in their life. Because no one in their country even knows what to do. Forget about releasing that dimple. Now, second, if you have a dimple on the track of the thread, you land up in a soup. Because then, why does that dimple happen? Your cogs have hit the dermis, as simple as that. They're not deep enough. So what do? You have to take it out. There's no option. Now there's a small difference here. I don't know if I've kept that picture here. There are lot of people will have natural depressions. And usually that natural depression happens just below the zygoma. Sometimes elsewhere as well. Your photographs will come to your rescue. I had a patient, 64, 65 from Australia. Post-procedure, she had a very deep depression after the thread. So initially swelling was there, so we didn't really note it. She went back home and then she started sending us pictures, and comments which were not very diplomatic. And you know what I mean, we all have this. Like, what is this? This, that, XYZ, flowery language and stuff. So then we took out the old pictures and then we realized that that depression was there naturally. So you have to note those natural depressions on the face and tell the patient, otherwise your life is miserable. Because one, the patient is paying a lot for it. We all know if a patient pays more, they also suck more blood. So they will suck your blood if you do not tell them. So I'm telling you practical problems because we in India face this a lot. I mean, I believe when a plastic surgery patient signs you up, you become their son-in-law. So you have to do everything that they say. That's literally how it is in India, we all know that. So that is essential for you to know. Mark that, tell them, because if you don't, that depression is not going anywhere. It will get worse because you have told everything that whatever the little bit of dermis cover was there or fat will get pulled and the depression gets worse. So you have to tell them that. And in fact, more important that mentally you have to take a note of it because when you are doing the procedure, what happens if you see a depression and say, okay, let me do it again. You do 3-4 times, but that depression remains. That is because it was always there. So we've had one or two situations where we were a little casual, okay, this happened. And then the depression doesn't. So then we got all the pictures, put it on the TV, analyzed it, said it's fine. So we just did it. So if I have, there's a 90% chance, of course, we'll be doing the procedure today. I'll show you how deep we go, and there's a certain test that everyone has to do as you get it. So I'll give you a very practical thing of what needs to be done. So some of you will be coming for trainings, and Vikas is going to make sure that he's going to come to every city to make sure we get into this. When all those of you who have done hair transplants know that unless you are in a very comfortable position as a body, you cannot do a transplant because you land up with problems. And what does comfort mean? Neck in a certain position, shoulder in a certain position, elbow in a certain position, wrist in a certain position. So if you try doing hair transplant like this, you can't do it. And that is exactly what you have to be very, very careful with threads as well. The moment you do this and put the thread will not. The moment you do this, the thread will not. And all the ladies here, please get your boyfriends, partners, husbands and start shaving their faces, because without the use of the left hand or right-handed lefties, this procedure cannot be done. Because otherwise, there's a way to do it as well, but it's a little more traumatic. So the use of the left hand and the right hand is essential, and your left hand has to be as precise as your right hand to put these things. So these are things that I've learned as I've started doing it. You will not get these instructions online. So note some of them, because the technical part you've already heard. I'm telling you what is going to stop you from doing these things. Suppose you do this when you're putting the thread, you will not be able to do it. So we are a team of 3 plastic surgeons. My other plastic surgeon, so she was doing one case a couple of days back. So while she was doing, her shoulder started rising, her elbow started rising. So I slapped her. So we do that. We keep a sort of a large instrument, one tight slap, and then she gets normal. So you have to be careful in doing that. The reason I just hit her, was because the lady who came to train me from France, I don't know how many times she hit. My nurses were like, this guy is tolerating being hit by this lady who's coming from France. No one knows about it. Please don't take it. I know the country knows me that I'm perhaps the most arrogant plastic surgeon, male plastic surgeon in India. So this is another patient, and so we can actually get these kind of results in India. And if I had done her neck, she would have been even better. So these are just 4 threads. This is about 15 odd days after the procedure. Next day, so what you can see is the face starts to look a little more happy. I'm not saying the lines will get eliminated. They never do. They get better. And in younger patients, now I've even done patients as young as, the youngest has been 34 or 33. You actually stop aging, retard aging, because it acts like an anti-aging tool. See, if your muscle, so I'm using the word muscle for smarts or whatever, is fixed, the skin is a normal, it will shift up, and gradual aging will bring it down, but it is already hitched up. So you are decreasing the physical age of the face a certain number of years, and 5 years down the line, you will age 5 years less. So that's the sort of what I tell every patient. Oh yeah, this is that lady. So if you see this depression, so this is what troubled her, but then it's already there from before. So that is what saved us. Now you can see the jawline. I think she's 65 or so. I mean, a candidate for a facelift. But what we see is she looks happier. She looks younger, more youthful. Not too dramatic. Not too dramatic because for that we would need neck. We would need a lot of other things. She was very low on her budget. So all we could, I think we only did 6 threads, if not 8. I don't know. I've started a new technique for the jawline. I hope we can get an opportunity to see that as well. Today, I'll stick, if you're doing the surgery today, we'll stick to what is the basic. I'll not do any theatrics today in BOP. We'll just stick with what is basic because once you learn that, you can start revising your own. Again, a slightly heavy face, you can get this kind of a look. She's a mountaineer from Dehradun, so you can do that. She's ex-air hostess in Air India, 36 or 35. So what you will see is you might say there's no change. But when you look closely, you'll find the face is a happier face. The face is more glowing. Everything on the cheeks looks better. On a younger face, you cannot look more dramatic than that. This is a very interesting story. So this lady is, she was very upset after, the only patient who has been very upset after doing threads, the permanent threads. And she was like, I'm really upset with what has happened. What happened? You look pretty decent enough. What else can you do? She said the problem is something different. Earlier, I was doing absorbable threads. No one in my family came to know. Now I did this. My husband is saying, "What have you done? Why do you look young?" Like, is that good or bad? I don't know. But she said, "I have now to tell everyone that I've done something." So that is testimony to what is the difference between absorbable and non-absorbable. So this again a youngish guy. He was my first neck patient as well. Pretty decent. Oh, now this is dramatic. So she's about 38. She's from Shimla, and you can now see how she looked, say 2 or 3 days later, and the pictures on the extreme right are from about 6-7 months after. So such a dramatic change in the shape of the face. So I really think 6 months later, a surgical facelift will only be about 20%, even if it's 30% better. There's 3 or 4 days of downtime to this procedure. I think it works. Again, a significant inversion of the facial triangle. Didn't need the neck anyway. Yeah, so this is again, so the lady on the right is the daughter of that lady who had that depression, the Australian one. And the first picture you see how the face looks more youthful. And I think that's what we are totally aiming at. A happier looking face which is more harmonious. Please remember, I do fat injections under the eyes, cheek region in almost every patient. Even if the patient is not paying for it, I still do it simply because it adds to the result. So some of you might see that glow is there, or the cheeks are a little better. So I would feel even if the patient is not paying, please just 5 minutes of our time, that it improves the results. So this is a very interesting patient. So the picture on the extreme left is the one on the day of the procedure. So she got me pictures of herself 5 years back, and then she came to me 3 months later, and she showed me the 2 pictures, and she said, I look exactly how I looked 5 years back. So this is dramatic. I think this is a beautiful result. Excellent skin quality, an ideal patient for something like this. So you can actually achieve something. So now I'll just go on to a couple of videos. I'll run through the procedure. So markings, I don't know if I really need to get into it because I think there was a very, very descriptive, the markings. And the only important thing, please remember again, for the sake of repetition, at the cost of repetition, stay away from the laughter lines, stay away from any line that you see, because we all know you can't put anything in the lines. So that's that. Now, there's another interesting concept. If you want a little bit of an lateral eyebrow lift, little controversial. There's a surgeon in Turkey who put this up there's a group of the thread users, the permanent thread users, and they put it up that if you take the thread, instead of taking it back, you take it anteriorly, you will get a little bit of a lateral eyebrow lift. We've had that patient, I've noticed that, but when I discussed it with the founders, they said it's probably because you started little more anteriorly rather than here. So maybe that pulled the eyebrow. So you will learn this as you do. So there are certain landmarks. So I started off with landmarks when I started. Now I do as per what my intuition says. So I'm not too fixed on landmarks and measurements. I'm a kind of a that freehold kind of a person. I just do what my intuition says and usually works. So Ankit, okay. So I'll spend about 5-6 minutes. This is a very long video. I really want you all to see it because this is how we actually do it. I'm not going to go very fast. So we start off with a small bit of local anesthesia, 4 dots. All my patients are done under sedation. Very rarely would I do it purely under local anesthesia because it does get a little uncomfortable, especially the pulling part, the end part. So about 1.5 ml in each tract. Let's go a little faster on this. And another thing, you have to know where your thread is going to go. So your local anesthesia has to go there. So suppose you do not fill the local anesthesia under this mask, the moment your needle goes there, it will hurt the patient. So you know if the patient has pain, you're in the wrong plane. So either give more local anesthesia or change your plane. A patient cannot have pain if the plane is correct and the local anesthesia is correct. And we always put local anesthesia drops on the exit points because if we have marked the exit point, we have to come out through. So that is essential because that is the marking. We all know the markings disappear when. So this a little fast on this. So I've just injected 4 points here. Skip this part. I'll talk to you about this later in the day today. Because are we doing a lucky draw for someone to yes. Okay, so I think we need this just go back. So why I actually showing this video because you've already seen something here. This is just an actual video of the procedure. So there's no fast forwarding or anything. So you need to see how laborious it will be. See the key problem in these, the only problem you will face in the initial 4 or 5 cases is how to manipulate the needle. The needle has to go like this, it has to go like this, it has to go like this. So doing that inside the face takes a little bit of doing. You all get used to it. If I could do it, anybody could. So I rate myself at around 6 out of 10 as a plastic surgeon. So if I can do it, anyone can. So I think we're going to start with the first needle here. So this is my left hand. So if you see one thing here, I don't know if you noticed, I was actually pressing this little hard and pushing the needle because I wanted to go slightly deep. I do not want it very superficial. And you'll notice something interesting as I do that. Yes, this move. So the moment you go in, you have to start pulling it. Because if you don't pull it, the threads won't pull. That means you're in the wrong place. So the needle is the thread. Remember that. If the needle is not in the right position, the thread will not be in the right position. So please remember that. At all points you have to pull. So in fact, every 1 centimeter of movement initially, go pull, go pull. Because if it does not move, you're wrong. Just come back, start again. More trauma, of course, more swelling, so you all know that. Keep going, keep going, keep going, and at the end, so as you exit, so what happens is if you keep going in and just exit out, you will catch the dermis. And if you catch the dermis, that dimple is common. So what do? The needle goes like this. You turn your hand and the needle goes down. Then turn your hand and the needle comes up. So that takes a little bit of practice. It's very easy to do. So that manipulation has to be learned. And the moment you go vertical outside, your dermis is clear. You will not get a dimple. Right? Does that make sense? You will learn this. I mean, you will do it. So if you see my hand, I'm going to exit now. Yeah. So if you saw my hand, I put my hand down because I want the needle to go down, and then I would immediately come up and just takes it. So the hand has to move like this. That's the only way you can actually bring it out. It does look traumatic and it is traumatic. So we are not sure. Now, next, the thread is going to be introduced into the needle. If you see, so I'm just going to go back. There's something very important that you must know here. Unfortunately, we don't have the thread here. The thread is very abrasive. When you run your fingers on the thread, you actually feel it. It's quite, the paws are really big, very sharp. Now, when you pull the needle, the thread is going to pass through the tissues and out of the skin. If your direction is wrong, it will just cut through the skin and it will cause you a bad scar. So how do you prevent that? Let's see if this next action shows that. So the thread is being placed in the eye of the needle. I'm sorry, I'm not fast forwarding it because this is essential. Any one of you is press biotech, let me get someone else to pull the thread. You can't see the needle if you're press biotech. I've had to start using loops to pull the threads. So if you see now here, can you just appreciate the C movement of my hand? It's a circular motion. It's not this. It is like this. The reason is the thread has to come out like this. It will not damage this. So that's the thing. And then in the thread, there is a central black segment which defines the two directions. So the thread is bidirectional. One of the threads is this side, one of the threads is that side. So the black dot is the center point, that's the fulcrum of the thread. And the next part is very easy for putting it upstairs. So we don't need to see that. But let's go back. So this movement now just continues. So I'm skipping this part. So 4 or 8, 6, whatever you do. In your initial days, you will have, my third thread has always caused me misery in my initial days. So that's where the depression used to be very common. The fourth is very simple to do. The only problem in the fourth I faced was the largest number of hematomas I had in my foot. Just in front of the ear. So I had just changed the direction a little bit. But the bleeding was maximum in my fourth. And the third was, for me, it was the most difficult. But now, of course, so again, all of you will have your own experiences. So it's not that he had the third, I don't, I'm better. You all are better. Now, there's one thing which I'm doing wrong here is this. My hand is sort of slightly extended. What happens then is the needle curves inside. So you have to be very careful. When you're pushing the needle, your hand cannot go like this. Otherwise, the needle moves inside. So just be little careful of that. Skip this part. This is the point where we are going below the SMUS, into the SMUS from the right. So the second, third, you have to really push to go below. And feeding the tissues. That's what we saw in the morning as well. I do this movement a lot just to make sure the depth of the needle is exactly where I want it to be. There's one key pointer, if somebody wants to just memorize that. All along the length of the needle, the tissue depth should be uniform. You can't have road rollers and speed breakers. It has to be very uniform. So action will be on the other side. So just take this like 40 feet. 2 seconds. I've got my WhatsApp open on public. Let's just hope nothing updates. So next part is the tightening part. I'll show you how that works. Big screen is on. So now what we do is we make the patient sit up and then we just pull and we actually feed the skin. So when we pull this thread, we actually pull, push, 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 push. So we're feeding the tissues right onto the scalp upstairs. And then this kind of a dimple is left. You can see these small, small dimples. Now, this is harmless. All we do is just take our finger a centimeter or two above the dimple and then just release it. It's very easy peasy for this. The Gen Z says, huh? Easy peasy. So just fix it here and just release it and it just solves it. I don't know if I'm doing that here, but yeah. So in fact, if you see the dimple here, just make this right. So I'm just holding it and I'm just releasing the dimple. So this is something which you will all be doing. For me, at least 6 out of the 8 threads need this place. There. That's all that you need. But this finger on top has to be stable because this keeps the thread pressed. Otherwise, the whole thing will come down. Your pull will go. So you can see the dimple being released. There. So yeah, you can see now it's a normal thing. That's pretty much it. There's nothing else that I want to talk about. Complications, hematomas, and infection, you have to be very careful. If hematomas happen, there's nothing much you can actually do. It takes few weeks more to get okay. I tell all my patients, 1 week of swelling, do not keep any important activity in 1 week. At least for our patients, we've had 1 week. In fact, even up to 10 days of swelling. Especially maybe if you do additional procedures, you have to wash your head, shampoo everything before because you're not allowed to do that for a week. No cosmetics. I've had women coming nicely decked up for a procedure. Doesn't work because you've got oil and stuff. You could just scrub their faces off before because you've got openings and you've got implants. You would not do a breast implant with makeup all over the breast. You cannot do facial implants as well. So tell the patient nothing on the face and they're not allowed to do any makeup or anything on the face for the next 1 week. So if they can't, please don't do the procedure. Otherwise, you'll end up with an infection. So as simple as that. Right? So that's all that I had to put across. I quickly, Vikas, over to you. Can we take some questions or do you want to do Vincent? Or do you want Vincent? We can. Yeah, I don't know if there are any quick questions. We can have a few minutes to do that because then after that, Vincent will talk about how this thread. It's amazing, when you actually talk to his dad, it's so amazing to learn how they. He's such a simple person. I mean, he's such a gentle person, and he really teaches you as if you are his son. So that's the beauty of that man. So, and he doesn't speak good English at all, but he still gets the message across. It's all those. It's amazing. I was really hoping he would be here, but it's amazing. And Vincent is an excellent person as well. So he's the CEO of the company, and before he comes up, you want to ask.
So do you put any dressing or strapping or pressure garment for the face?
Is there another mic where we both can handle each question so we can give different opinions? So I don't. We just clean the face with sterile saline and we just let the patient rest because they are under sedation. So 2 to 3 hours we allow them rest and then they can go back. Some of them are from outstation and we keep them with us, but nothing else. Sorry, I think he has a follow-up question.
Would it be a good idea to put a strap like we do for?
So sometimes, yeah. So what we've been doing is if I do a neck liposuction, I put a chin neck strap. Otherwise, I don't. It's painful to actually. You see, these threads do cause a lot of pain in the post-op. We've noticed that 2 to 3 days it is quite painful. So add on a strap. It's pathetic. Dr. Rajesh.
Can you do the facial liposuction?
Sorry. Do you do any dressings on the face?
No, I don't.
Do you do any sort of antiseptic or something on the face for the holes?
No. Okay. No. Sometimes, according to me, we have to do attention to the patient that have PET. The problem for me of the infection, the main problem is the buried hair, but also the PET in the house. So the animal in PET. So because you know they are dirty, and so I think that it's not a problem of antibiotics, creams. It's a question of to say that the patient that in the first few days she must have attention.
I think that's good in India, that we have children, we don't have any pets. Doctor.
When you do the facial liposuction, do you do it in the same setting? Or do you give a gap and then do the threads? That's question number one. And we find a lot of patients have very, very thin skins, and we find the threads do not hold. Is there any skin prep you do in terms of giving some energies or something where you build up the collagen and then consider the patient for a thread?
I'll answer. Give your opinion. So first question is, you got the questions.
Yeah, if I perform liposuction in the same, I perform liposuction if necessary because we put threads in different planes, so there is no problem.
We do the facial liposuction with laser at the same time because that's subcutaneous, so the threads are deep. The second one about thin skin. If somebody has thin skin, do we build it up with collagen or something? If someone, so sometimes the skin is very thin.
If the skin is thin, for me is not a problem if the skin is without elastosis. The problem is the elastosis, the skin damage, not the skin thin. Or the skin thin is not a problem. It can be permits better results because the tissue that are thin are less heavy, so you can perform better results, but without elastosis.
So you will get very good results if the skin is thin compared to someone who's thin.
Suppose the patient is undergoing PRP therapy for hair treatment, can you continue? Or you are seeing?
Someone is doing any PRPs or stuff on the hair for hair fall, is it okay to do these threads at the same time?
If I do scaffold,
If a patient is doing PRP for hair fall, can we do the threads at the same time?
Yes, why not?
Unbelievable, to be honest. I think your question might be, can we puncture the threads
Yes,
accidentally?
In that area.
No, we are very deep inside. I don't really don't think that's
The thread which remains out, which comes out to the exit point, you just cut it.
Just cut it and let it retract.
That is always, or you can use that again. That's a long length, that's a very Indian way.
I was going to say very Indian. That's easy. If you can use it, you can't. The problem is you need a bit of, I thought of that. To be honest, I thought of that also. So you need a bit of thread attached to the cords. So I
have a question to Dr. Lucas as well as Dr. Amit. Hi. See, can we use these threads to do an eyebrow lift? And if at all, then how it has to be done?
Okay. I don't utilize it for the brow lift. Personally, I don't like this kind of results because the tissue are too thin. So, for example, for the brow lift, according to me, the tissue are too thin in relation to the diameter of the thread. But it's my personal opinion. I know that a lot of surgeons perform eyebrow lift with. I don't like eyebrow lift with the threads in general. I prefer with the surgery.
So great, you wanted to ask.
When you are doing the procedure, most of the patient looked as if you're quite superficial.
At the end. So as you enter, you keep going deep. So right, in fact, the tissues are very, very thin. The superficial temporal fascia is literally attached to the joint. So what you might see as being very thin, when you actually put a thread in, you are 3 or 4 layers deep.
So the anchoring point is deep temporal, where are you anchoring this?
Where do you anchor the
I
thread?
have
Which layer?
this way.
Which layer of the face would you anchor the thread up to?
Which?
Which layer of the scalp do you anchor the thread up to?
Yeah, scalp.
So
Anchor.
The angle. The angle of the scalp. Sorry. Okay. At the beginning, I completely vertical because I don't want to catch the dermis. Okay. So completely vertical. After that, when I'm in the subcutaneous tissue, I'm horizontal.
Dr. Manish is asking which layer of the scalp is the thread in? What acts as an anchor? Is it the superficial temporal fascia, the deep temporal fascia?
Okay. In this area, do you want to know in what kind of plane am I? Okay. If the tissues are thick, I'm in the subcutaneous plane. That is the most safe, the safest. But if the tissue are thin, I'm under the superficialis fascia. To be in the superficialis fascia is not obvious. Requires a sensitivity. But according to me, there is never a problem because the branch, the temporal branch of the facial nerve is a motor branch, it's not a sensitive branch. So if I think that if we should catch this nerve, there won't be a problem because it's a motor nerve, not a sensitive nerve.
Yeah, I have a question.
So, ladies first?
You said deep to smash. How deep? Deep to smash is a big layer again. So how deep to smash? That's my first question. And second is, what difficulties would you face when you do surgical?
How the needle is going below this mass? Can we define how deep to smash?
Yeah. The question, I explained the question before. This is the challenging point of the SMAS technique. There are some few anatomic points that you have to be sure to pierce. The retaining ligaments. Okay, we are sure that we are in the SMAS, in the sub-SMAS plane, when you do the same maneuver that you should do if you perform a high SMAS facelift. So, at the level of the zygomatic arch, you with the left hand you push the tissues and you pull the tissues and go with the needle under this tissue. And the retaining ligaments, the zygomatic ligaments, are 4 or 5 centimeters in front of the ear, and they continue for several centimeters. And when you put the needle inside this ligament, you can hear, but you feel with your hands that you are pushing, that you are piercing these ligaments. Okay. There are also the ligaments, the parotid ligaments above the parotids, and there is the cervical ligaments here. It's just make it more dangerous. But there are the masseteric ligaments. I pierce the masseteric ligaments, and I know that I am under this mass because in the subcutaneous plane they aren't. That there are just retinacular cutis that are completely different.
There's no real way to define how deep to do this. You will feel it. See, the thing with tactile procedures is it's experiential thing. You do it, you feel it. You know you're below the SMAS because you've already punctured some structures, you feel the resistance. And there's one movement which I did of feeling the needle. If you come subcutaneously, you will feel the needle. So then you have to come back and reinsert it. So once you're inside SMAS, it actually doesn't come out any. Now, how deep, it doesn't define 2 millimeters, 4 millimeters, what we would never know. The second question you had asked was, suppose a patient undergoes a surgical facelift 4 years, 5 years after these threads, is it tough, easy?
I think that there is no problem if you want to perform a surgical lifting after the threads. You are asking.
Yes.
I think also that the threads should never be removed because they are biological stable. So you perform the face lifting. Maybe you can re-pull the threads, maybe not, but it's not a problem. It's never a problem.
Yeah, what are the,
So one of the things Priya is basically, see, like a breast implant is also form a, I mean, theoretically they form a small capsule and they are inert. They do not create any inflammatory reaction at all. Unlike the absorbable threads which work on collagen formation, these threads don't. So you get a smooth plane, and that is the reason why pulling all these threads is very simple. So what is said about these is 10 years later, if you have to do a revision procedure or a facelift, it's easy to see.
I did a facelift in a patient who had these threads.
Permanent threads?
Yeah, permanent. So my smart was not moving when I was trying to lift it up. So I had to pull out because it was fixed.
Fair enough, yeah.
So I had to
So,
pull out.
so there was a physical effect on
Yeah,
the threads.
So it was fixed
Very
completely,
interesting.
leading to distortion. So I had to pull out everything
And then
for
you,
my smarts to be no harm.
So could you
Okay.
explain? So
no, not really first.
what are the chances of injuring the facial nerve or getting it entrapped?
Only zero, but have you noticed any facial nerve injuries during the procedure?
No, I never had.
But we are going deep, so how?
You're just literally just touching the undersurface of the mask. Facial nerve will never
assess that how deep we are going or anything. Safe.
I really don't think you can actually injure facial nerve.
According to me, it's not possible.
It's not possible.
It's not possible.
Can it get entrapped?
Yeah.
By pulling the thread?
Can the needle pass through some around the nerve and can it entrap the nerve?
Okay, you can, from a theoretical point of view, you can trap the nerve with the thread, but there isn't a nerve that is isolated from the surrounding tissue. You entrap the tissue with the nerve inside, and this is not a problem because of the constitution of the needle, of the thread, because the tips are blunt. So, according to me, it's never a problem.
when we are doing like this with the number of threads, then the entry point will be from here, and then how do we turn it? from the center?
So today's patient, if all goes well, she also wants to do her neck. I'll show that to you after.
One more thing, sir. Can we only do threads for leg lift and not the face, or you like you need to do the both?
Have you ever done just the neck and not the face?
Yeah, sometimes I do just the neck and not the face, and just sometimes just the face and not the neck.
Have you both used these threads for any other indications like the nose or the breast?
Have you done it apart from the face?
No.
So I have
Face and
seen.
neck.
Because there are a lot of other threads they use for the non-surgical,
Yeah.
the tip rotation, and people also advocate threads for breast lift.
Yeah, and ACCL used for the nose, for example, in Bacina Cadaver Lab.
I haven't used it.
You-
Why haven't you used it? Why haven't you tried it?
I really don't like these threads in the nose. I really don't like threads in general in the nose, but it's my opinion.
Dr. Rajesh, when I was in Nice, the very first surgery I had seen was the nose itself. So they had done it for a tip lift. I would probably not take the risk. See, it's too superficial for me. I mean, it requires any years of experience to enter that region. And the manipulation of the needle here is so tough.
Yeah.
I mean, you hardly have any space to move the needle. But of course, I mean, years of experience and I would, again, threads on the nose, no. But yeah, theoretically, yes. I have done it for a facial asymmetry, two threads on only one side to match an asymmetry. Breast. So my wife looks after my business and she said, why don't you do it for the breast? There's such a huge market, they don't want surgery. I said, that's the last time you asked this question. So never put. There's no anchoring point. Where do you anchor it to? These threads are anchored here. Where do you anchor it on the breast?
Yes.
So, and the weight of the threads, these threads are just threads. So I think we're done. Because you want to yeah, oh, sorry.
Chances of silicone granuloma, and also one more thing, the tensile strength of this silicone should be hard enough, right? That is why you can make this threads so sharp. So there will be chances of fracture of the cord vessels.
I think Vincent would be better able to answer the physics of the thread. So we'll wait for him to ask him. Silicone granuloma is one question. Is there a possibility?
The silicon granuloma is a problem of the liquid silicon, and it could be a problem of an infection also of the silicon solid. But if you don't have an infection, the problem, the advantage of these threads is that they don't move. So if they then don't move, the fibrosis is minimal, and the granuloma is theoretically not possible.
So Vincent, when you are here, just answer this question during your talk as well. Can it fracture? Can the tensile strength go low? And I think the composition of the thread actually answers that question. That he's the right person.
Yes. Can you hear me? Yeah. So thank you for the question. So first of all, this afternoon I have a presentation covering more precisely the composition of the threads, and so I guess I will answer a lot of questions regarding the materials. So regarding the fracture of the thread, so I will give you some insights about the history of why we created Infinite Thread, but you need to know that the first thing we put on our list when we created Infinite Thread was the mandatory condition that you can remove the threads and that you will never have any breakage of the threads, and you will never have any slippage or breakage of the silicone. Because obviously, when you're using a permanent device, you want to be able to remove it, you want to be able to remove it without creating any scar, and you want to remove it completely. You don't want to let part of silicone inside. So for this reason, the traction power of this thread is very heavy, but also the resistance of the thread. That's why we use polyethylene terephthalate for the core of the threads and silicone. So silicone is very flexible. Polyethylene terephthalate is not flexible. So you will not break the silicone because it is so flexible and so very resistant. So basically, if you want to break the thread, you need to put more than 2 kilograms on the thread. And what you will break is not the silicone. Actually, you will break the full threads, but what will break is the inside. It's the polyethylene terephthalate. And it's not a big deal. If you break it, you're just doing a little puncture and you extract the rest. What you don't want is a part of the silicone to stay alone as a little, let's say, little parts inside, because this would be more difficult. You would need to do a facelift to really remove it. So what you want is always the thread it will not happen, but if it breaks, it will always break before the silicone to slip. So this is your security. If the thread is breaking in the middle, which will not happen if you're not pulling 2 kilograms a lot, you should not do it. And that's why we do training course, that's why we have protocol. But let's say you do it. It's not a big deal. You can still remove it, and the silicone will not move from the threads. So that's really important to understand that the silicone will not be left alone in the face of your patient. I don't know if I am answering the question correctly, but I heard it was your question.
Absolutely.
I will go deeper in this during my presentation.
So when you actually tighten the threads, there's a significant amount of pull which is already put there. So you'll see that in action. Vikas has this wonderful box in his hand. So today, so I'll just run back to get GK2 where just get the patient ready. So one slip out of this has a name who comes with me, and I'll make them do 1 or 2 threads with me today. So this is out of syllabus, but I think this is a good thing. So Vikas, again, please pray that the patient doesn't cancel. I'm literally on my toes right now. सारे मेरे नाम हैं.
Lucky one,
Oh, there you are. See, so Nandini is from AIM, and you know that question about tensile strength is very Amazonian. Most of the people would never think of it anyway. Okay. So,
Can we have one more?
no, not today.
Yeah, thank you, doctors. So, we will then we will start.
I think we actually. Then we go. They don't take care of they don't take care
The threads is the best way.
You know that, right?
Yeah, and we don't have a problem or we are less technology. But other probably right. And then no problem. But the result is something the patient say. You are not the same name person for the half. Good, you after 1 to 3 stop, move the needle, see, okay, so I go, I will come back, I will turn back, right place. So at the end, sometimes it's good, other times, the touch, the thread is less power is absorbed, will obtain less result the temporary threads are threads that are are sharp. So threads if you are masculine, you can have eating. But at the beginning, for the manuality, to put down. That you have skin temporary, permanent area,
So it's easy to remove these threads when they come out easily.
room, the day out. Because we have wet, yet wet issues. Wet. So if you have to touch, touch the dress, those commands, those disappear. You do the anesthesia, wait,
Release that
also after 1 week, you do the anesthesia, the long anesthesia, wait, then 15 minutes, in a dry tissue, they are
how about removing it completely if
you start from entry point area. They are in the web. But if you have to do after 1 month, when you do the anesthesia, look at the picture of the journal, and you do the anesthesia, and then you cut the 1 centimeter to reach the traffic is when you reach the thread, you pinch with and you pull very okay, and with the left hand you use the movement from the top to the bottom, okay. Wait.
Sorry to interrupt. I am Dr. Avinash. So any transfer of leakage of thread and pulling it out, leakage of thread and pulling it out, because threads are engaged in action. So can set break when you are pulling it out.
The only possibility to break is the reason. Close the right place. But if you don't have an injection, you don't have yes, you have an injection for the a colleague of mine, my young colleague of mine, had an injection because he spreads in not room office. Sterile. So yes, infection. But he was able to but this would be a problem. In this case, you have to use a hook. Yeah, hook in this case is big. But always search 1% of the patients that are met but 99%
Sorry to interrupt before you just one small question. Politically speaking, the crop sector is supposed to get engaged in the tissue, eat the fabrics, and that's how they pull it up and they do the facing. So here we are not entering on that section of tissue.
You are asking me about the fibrosis?
So I'm saying, when we do everything,
That's right.
we are supposed to engage the tissue, and by the time section absorbed, there is fibrosis around the tissue, which keeps the tissue anchored.
Okay.
While in permanent threads, we are these threads, we are looking that we are saying that crops do not do fibrosis.
Yes.
What is the mechanism?
About the mechanism of the permanent threads,
Sorry to come.
this is a very progressive, no? Because it's the same question that from 30 years we speak about the capsular structure. No. So what I'm saying to you is that scientific but also not scientific. According to me, the problem of the process is the movement. Just movement. Because now that we use the mammary implant with the surface disc, we never have a capsular contracture. When we use allergen, where made with the salt, the capsule was
surface.
If we have a silk surface, we don't have a problem. A smooth surface, we don't have a texture surface, we have a problem. But we need a texture surface for the anatomical people. So I use modular implants, for example, because I don't want the textural surface. It's the same problem with the problem. It's smooth. It's problem. But you could have problem, just a little problem, with the movement. If the working back is smooth, but she moves, and so
There is a friction.
there is a friction. The worst option is a textural implant that moves. It's a big friction. But also, move and move. So, according to me, according to me, there is a study, but it's just one study of 7 years, and the most that there is no fibrosis. Yes, it's minimum. Minimum fibrosis is not a problem. Right. But I think that it's a logical problem. It's a biological biologically, the symptom is not
acting like that.
yes. So,
So no fibrosis.
there is a
Just
study of 7 years, but you can think to the mammary now we use
my area.
yes, you have the you mobile matter. It's different. When you move the muscle, zygomatic, the little zygomatic razor, the under. Okay? Under is the part that is firm. Not okay, I do the massage, but it's not that much. Yeah, right.
Thanks so much.
आपके इजी बैठे को 4-5 मिनट पहले नहीं करो होगा ठीक है क्रांति यही है हां यही है क्रांति दो बोर्ड का स्टेज नाम लगा मेरा नाम गगन बताया गगन दो बोर्ड का स्टेज स्टेज हां और बात लगा कर नहीं यही है स्टेज
I think yes.
Okay. Okay. With your next. Okay. Yeah. I think it's good to go through everything. What do you think? Okay. You will be there as well? Yes. So you can use the who is marketing.
यानी कि inside किसी को देने का चैन से and then you always follow
Thank you.
This way, this thing anchors up, this thing anchors down. This is the upper part. Yes. The same J, when we do J, we do this. We have the middle up. So, but actually, just about half a centimeter. Yeah. Half a centimeter in the middle. So this direction doesn't matter. Now this direction is pulling it up, but here the direction becomes pulling it down. So your legs are pointed like this. So when you turn a J, it's going to pull down instead of pulling up.
No, yeah, okay. Means that's the structure.
Yes.
Initial my presentation is a people that say like so we never do like this situation.
Just for long, I understand.
Like this shape.
So this one is going to be like this. This one is going to be down. This is just more of a long time.
The goal is, yeah, to lock fixation. During the democracy. It's very well. Because if you go straight, if you have your face here, you need to go straight like this. During the first 2 weeks, always try you are more this is where you have to move it. So if you just go straight, because the tissue are in the liquid, you might lose a little bit. So you might lose maybe 2 weeks. Because of the you make sure the tissue is out that's just like this. Like, not 2 weeks. The J is not too but it's allowed you to keep the result when you have the name. So the patients is you are not needing to result of threads. Okay, you need to sleep back. And don't do that. It's outside. Yeah, that's what yeah, what you don't want is for the next maybe birthday, you don't want to pass outside, you can really events anyway, but also you might you can do solar on the days. that's it. That is, so much. So if you only use 6, you have one more available. Yeah, one more. It's all like, yes. Because the best result is they are very good things. Yes, so 4.6. Yeah, so if you use 3 by the one is the development but I would not, I know that you don't, I know there is a difference, but there is a difference between 6 and 8. Change a lot. Yes, the neck, it depends. For the face, what is the best? So, and then if you go to the neck, so it will depend on face. If you put only 3 for face, which my opinion will be the best, then you can add one more here, and so you can do one box. Yeah, that's yeah, if you do but this technique, I think we can it depends. If you saw that most of them they are using different they were using yeah, okay. You need one and one or you need 2? Yes. Yeah, okay. That's what we do in the 1%. We have my I will send but in the back, on one side, no, the pack is really thread and 3 orange and you have for this. But outside, when you do the trade, you see the tip of the screw. This is you have one straight or after. You have and we have so this yeah, one,
No, we have to do why sometimes you have that comes up.
Afternoon, doctor. So in next session, I would like to call Mr. Vincent, CEO of Thread Lift. Please come on, please. Please.
Thank you very much.
Hello everyone. Hope that you can hear me. So very, very grateful to be with you today. Thank you so much for your time on a Sunday. It's much appreciated. Thank you very much. It's a great pleasure for us to be finally launching Infinite Trade in India. So my name is Vincent Pimentel. I'm French, as you may hear my accent, and but I'm living in Belgium, in Brussels. So you might see that our company is from Belgium, but the trade is made in France. So I'd like to thank also all the team of Aesthetic Zone for organizing this. I'd like to thank Dr. Luca Cravero, our expert for a very long time in Italy and international speaker, and also Dr. Amit Gupta, who did very beautiful presentation this morning. And today I also want to thank the shop of clothes in New Delhi, because I arrived yesterday at 3 a.m. at the airport and I had no luggage. So I just had one t-shirt and my computer, so I need to bought some shoes and some clothes this morning. So that's why I missed the first part of the presentation. So thank you for the people that are selling clothes on Sunday. Okay, so Infinite Trade. So maybe I can use this. Okay, great. So I will give you a little bit of information about who are we, what is Trade and Lift Company, which is the name of the laboratory, and what is more specially Infinite Trade, even though you already have a lot of very good explanation this morning. So what we do is we are specialists of trades. We don't do anything else than trade, and especially permanent trades. So Trade and Lift Company is a family story. I created this company with my father, who is Dr. Jean-Paul Pimentel. He is a French physician. He is working in Nice, in southeast of France. and he's the inventor of this thread. So we worked together to create ThreadNIF in 2014, and the idea behind this was, let's say the truth. Like, I believe maybe you did not try, maybe you already tried threads, but I think that 90% of the case you were not happy with threads. Because you tried absorbable threads, or maybe the company who sold threads overpromised you amazing results, 2 years, 3 years results, and at the end of the day, you were mostly unsatisfied. And I can say that because it's the same everywhere in the world. And I saw my father starting to use threads in 2002, and he was using the first generation of threads, obviously Aptos threads, then you had other threads like Silhouette threads, and if you go back to the origin of threads, the first thread ever produced was Aptos in 1996 from Georgia, and it was a permanent thread. And right now on the market, all you can see is absorbable threads. So why the guy who invented threads, the modern threads, I'm not talking about the gold threads and stuff like this, but why the guy who invented threads, who is a surgeon, Marlen Sulamanidze, surgeon from Georgia, why his first thread was permanent and now the market is full of absorbable threads? The reason is polypropylene threads, which was the Gen 1 of Aptos, was obviously imperfect because it was the first generation. It was very sharp, so it can hurt the tissue. But the idea of the surgeon was, I am a surgeon, I do surgery, I want long-term results. So I need a long-term product, I need a permanent thread. But after a few years, what they discovered is that the product was complicated, it was not perfect, it was like the prototype, the first generation, it was complicated to sell. And surgeons have very high expectations. You do surgery, you can do a facelift, you can do a night lift. So you can achieve amazing results for your patients. So why would you take your time to change your practice to threads while you're happy with the results? And especially if you cannot reach good results and you need to manage after effect, post-op effects. So they change their mind and they say, okay, maybe surgeons are not the good targets. Maybe we should target dermatologists or aesthetic practitioners or people that cannot do surgery and they have nothing, only fillers. And so it's going to be easier to sell them the product. But if I do that, I know that I'm selling the product to some doctors that maybe don't have the experience of anatomy or are not used to do everything like you are. So if I sell absorbable threads, it's going to be better for marketing, obviously. Because if there is an issue, all I can say to my clients is, wait 6 months and the issue will disappear by itself because it's absorbable threads. So you don't care. So you have less problem. Your people in your company doesn't have to spend time to discuss with your clients saying, okay, how can you fix this issue? Just say wait 6 months, the problem will disappear. And so that's basically what all the company did. They say, okay, it's such more easier to sell absorbable threads because the result is no problem for the company, no after effect, easy. But the bad side of it is deception points. Like results are not that good, and especially for new surgeons, you cannot expect to have good reputation if you use this kind of devices. So I'm not saying absorbable threads are useless. I'm saying that absorbable threads cannot be 100% of your offer as a surgeon. It can be very useful for young patients, or it can be useful for certain areas where you don't want to take the risk to put permanent devices. But I mean, putting all the reputation of threads around absorbable makes what happens today means that patients doesn't want to have threads. They are very careful with the results, and you are most of the time not satisfied with the result. Why am I telling you this? I'm telling you this because I was seeing my father when I was younger, expert of threads, thousands of patients, and he was telling me that I don't understand why people do not dig deeper into the threads. There are so much things we can do, but you need to go back to the roots. You need to understand that if you want long-term results, you need to use permanent threads. You need to know how to use it, you need to be trained, you need to use it in accordance with the anatomy, and so you need to leave the absorbable things like crazy, stupid marketing things. I'm speaking frankly, like lunchtime lifting. Like nobody is doing a lunchtime lifting. You are not doing a lifting between 12 and 2 p.m. before you go back to the office. It's not happening. Not happening. So you want to sell it or liquid lifting. Like how do you lift the skin with liquid, with fillers? That's nonsense. And for a long time, I saw my father going nuts because when he going to Congress, in INCAS, in WC or everywhere, he was always hearing this kind of things. So one day he told me, okay, I operated maybe 2,000, 3,000 patients with threads, and now I know how to do to make a new thread which would be better because I will keep what I like from my 25 years of experience, and I will improve what I don't like, and I know what can be added. And so that was the beginning of the story. At that time, I was working in Paris. I did law study and business study, so I'm not a doctor. So I will not talk to you about deep anatomy, paradigm and everything. I much more rely on Dr. Pravero, and this is our philosophy at Trade. We say the truth. I think you saw this morning during the presentation that I did not ask Dr. Gupta, I did not ask Dr. Pravero to tell you everything is perfect, this is the best device on earth, you will have never no issue with this product. No. We are telling you what you can reach as a result, what can happen, and how to solve if you have an issue. And we want to be completely transparent because we want to be different than the other company. We will provide you with the best trade on the market, that is for sure. But this goes with a learning curve, and this goes with a training course mandatory to use it correctly. But if you do that, I can assure you 100% that you will reach tremendous results and that you will love the device and that you will be able to have more patients thanks to this. So our mission is provide you threads. We provide it only to surgeons. So it's not plastic surgeon only. Of course, most of our clients are plastic surgeons, but we're also providing it to maxillofacial surgeons, some ear, nose, throat surgeons, oculoplastician, but it's surgeon-only threads. So this is something we decided a long time ago in order to give you an edge on the other practitioners that use absorbable threads, and because we want your reputation to be safe. So we want you, when you give us your trust, to be sure that the only person around you that will use the product in the planet are the same qualification that you are, same knowledge about anatomy, and you will never risk to find patients online complaining because they had very, very bad experience with the product. So this is also a way to protect you to do that. And it's also, of course, for us, a way to be sure that the patients are protected. So what we want to do is to give you the same effect than a facelift, neck lift, or eyebrow lift, but with threads. So this thread is the first one that will not force you to decrease your level of expectation, to decrease your level of excellency when you use it. This is our history. So as I told you, the creation of Infinite Thread was July 2014. From 2014 to 2016, we did R&D. So we did around 50 prototypes in our factory in France to create this version of Infinite Thread. And the first thread was put on the market in February 2018. And so from 2018 to today, we are working with more than 800 surgeons in the world. We are in 27 countries, mostly all European countries and all Middle East countries. And now, I'm so grateful to be in India. And this year, we're going to start to work with more countries in Asia. So Japan will come next, and Thailand, hopefully. And we also have, in the next few years, at the end of this year, Russia and Brazil coming in. So around 20,000 patients have been treated with Infinite Thread. So that's a product that already has a lot of insights, and there's a lot of experience with Infinite Thread on the market. So this is a map of the countries where we are. So our business model is, we are a Belgian company, as I told you. So you can see the very, very little yellow country on the map. It's obviously very little compared to your country. It's only 10 million citizens in all Belgium, which is, I think, the same that only in Delhi you are 10 million. So obviously it's not the same. I'm French, So the production center is in a French city called Besançon. It's at the border of French and Switzerland. Because you have all this, you know, the watch industry in Switzerland. So it happened that they use the same machinery to do prototype for technical medicine products, medical devices. So there is some kind of intertwining between the watch industry in Switzerland and the medical industry at the border of France. So that's why there are a lot of factories there. So this is where Infinitrade is produced. And for a lot of countries in Europe, we are selling directly the product. And for some country in Europe or outside Europe, we are working with amazing distributors such as Aesthetic Zone, which is our partner in India. So now I'd like to focus a little bit more about Infinitrade. So I had some questions this morning about the product. So if you have some more questions, feel free to ask me maybe after the presentation or during the presentation, it's fine for me. So Infinitrade is a cutting-edge patented technology. So it's very new. There's a lot of difference with the thread you know. It's not only about the permanent thing, it's also about the design of the cogs, it's also about the positioning of the cogs, the number of cogs on the product. It will provide the patients and you, of course, the same result or quite the same result that you can have with surgery, which is something that no other product can say. It's it's in the same range of results and durability than surgery. It can be used alone, but it can also be used in combination with surgery. So today, 45% of the surgeons that works with us, that works with Infinitrade, also use our products during the facelift or during the surgical neck lift. I will explain to you why, but the idea is basically that if you put one or two threads during a facelift, it will be much more quicker because you are opening the skin, so you see what you are doing. You do not have to feel the path of the needles. You put the threads exactly where you want because you can see it, because you did your opening. And you have the effect of the threads, the distal effect of the threads. So it means that you can undermine less, and so you are less invasive, so you have less long time after the facelift for your patients. So it gives you a stronger facelift, more durable, and you have less invasivity. So it's very, very effective. This is something I am the most proud of everything in the presentation. Those are our satisfaction results. So since we created Thread and Lift and this product, Infinitrade, we invested everything we have in science and services. So we want to make your life as easy as possible if you trust us with Infinitrade. And so maybe you didn't see us with 100 or 200 square meter booths in big congress, or maybe you didn't see advertising at the TV or at the airport, because we did not put our money in marketing. We put our money in this, your satisfaction. This is the most important thing for us. We want to build something strong, and we know that to build that, we need to have a good product, help you to use it correctly, and rely on the satisfaction of yourself and your patients. So we are working with surgeons, remember that. So when a surgeon is using a thread, it means something, because when an aesthetic physician or general physician uses threads, it's because he cannot do surgery. When a surgeon is using threads, he can do surgery. So it means that he chose to use threads for a good reason, because he was able to provide surgical results to his patients. So when our clients using our product, it means that they can see an advantage to use it on these patients or to combine it with surgery. And having this kind of satisfaction rate is very important for us. As you can see, the quality of our product, all the surgeons that were interrogated said they were very satisfied or satisfied. The quality of the needles, quality of instruments, and also the patient satisfaction also. So you can see there is no red. So they were able to tick the unsatisfied or very unsatisfied, but all the people who were working with were satisfied or very satisfied with the outcome of the result. So this is also the consequence of the fact that everywhere in the world, so it will be the same in India, if you want to use Infinitrade, you need to follow a training course. We are not selling it online, we are not selling the product during Congress, we are not doing
big discounts. This is not the way we do. We're providing you top-notch products, and we ask you to do a training course in order to use it correctly. But this is not to to disturb you. We know your time is precious, and we know very much that you have a lot of things to do, and you have a lot of success and a lot of patience. But just by having you train in individual training or training or one-to-one, we can really take time to explain to you what will make the difference between an average result, not so good, but okay, with a good, very good result. And it will save you a lot of time at the end. And we also have this, and I will talk about this later, follow-up continuous training courses, a lot of things. So we have videos, but we also have real physical support for you. For instance, we have a nurse that will be able to come to your practice when you start to use our product to support you, to train your nurse, and also to support you. So I know that you cannot remember everything from a training course. So if you have any question or if you see some kind of indication and it was not the same during your training, you might be in a difficult position. You don't know exactly how to put the threads, how to react to something that is new to you. Then you have somebody close to you, trained to do that will be able to give you the tips and the information that you need. What we want is your experience to be smooth and you to be satisfying for you. Some key opinion leaders from all over the world and what they say about our products. So basically, Dr. Prabhu, you're on this slide.
Yeah.
So the idea is that this is very, very different. In a lot of countries, surgeons, the biggest question they ask us is, how can I market this? Because I don't want to call it a tread lift, because patients doesn't like tread lifts. And it's a different word from other kind of treads. So some are using French lift, some are developing their own name of technique. But the idea is really that it will open to you a very wide range of possibilities that you never know that was possible with treads. So what I was telling you before is that what we want to provide you is a product, Infinite Tread, which is in the area of the surgical facelift and neck lift. You will be in the same area of results. Today on the market, the biggest part of the market is PDO, threads from Korea. So at the basic PDO, there were no hook, no cogs on PDO. The PDO technology from the 80s, 90s was very, very thin threads from Korea in polydoxanone, and you put it inside just to create extra moisturizing of the skin. And then with the trend of the suspension threads, they add hook on it, they add cog on it. They say, okay, maybe we can sell it also as a suspension device. Obviously, this is very short-term results. It can be useful in some cases, I will not judge that, but it's just not the same world. Then you have the main part of the market, polylactic acid, polycaprolactone threads. Those are coming from companies like Oma, Aptos, Sinclair, Silhouette. I'm not saying they are bad threads. I'm just saying we are not talking about the same. Like it's comparing a horse and a Ferrari. You are not talking about the same things. Absolutely not. And for a Ferrari, I bring Italian doctor, obviously. So permanent threads is going to be very different. So you will see that you do not have to downgrade your results if you decide to work with. So let's dive deep into the biomaterials we're using. So for those, I was discussing this during the break. Here in green, you can see the polyester. So this is the core of the thread, and around you have the silicone. So polyester is a big family. So it's a simplification to say polyester. In the polyester, you have several different materials. The one we are using is called PET, polyethylene terephthalate. So polyethylene terephthalate is the most neutral biomaterial you can find. It is used for more than 60 years. This is the thread that is used for heart suture. So if you are a friend with working for cardiology, he can tell you that the suture that you are using to suture the heart, the arteries of the heart, is PET because it's neutral and there is no reaction around, there is no inflammation, nothing else like this. And it is not absorbed by the body. Never. There is no clinical study in the world for more than 60 years that was able to show PET to be absorbed by the body. Then we use solid flexible silicon around, because you want to rely on the strengthness of the polyethylene, but on the flexibility of the silicon for the cogs. And so the thread is bidirectional. So you can see on the very big thing here, so you can see the shape of the cogs. So the cogs will be like this here and like this here. So the higher part you use like this will be used for the threads to stay in position, not going down, stay there for years. And the lower part here, with the cogs in this direction, obviously are used to pull up the tissue. So you can use it in both directions, doesn't change anything. So it's bidirectional. You have 800 cogs on 30 centimeters. So this is 15 centimeters, this is 15 centimeters. And you have a black spot in the middle. So when you use the product, you can see immediately where is the middle, so where the cogs are changing direction. The diameter of the thread is 1.4 millimeter. So this is basically 0.5 millimeter, 0.5, 0.5. It's 0.45, 0.45, and 0.5. So the cogs are as long as the middle of the thread. The thread is made in France, and it is CE marked since 2018, and it is registered, as I told you, in 27 countries. The latest one was India. We have a specific patented technology. So this is something you will not see on other products because this is our patent. The patent is based on two things. The first thing is what we call the 8-axis hooking technology. So if you look at the thread from the face view, you have one cog north, one cog east, one cog south, one cog west. And the next one is rotated 45 degrees. So the next row of cogs is like this. So you will catch tissue in 8 different directions. Why do we do that? It's because what you're really catching in terms of pure chemical anatomy is connective tissue. It's elastin and collagen fiber that is going through the hypodermis, the mass. And this is like a big spider web. It's going in every direction and it's different for every people in the world. So the more axis of catching of this tissue you have, the more power of traction you have, and also the more precise you will be able to do symmetry of your patients. The more precise you will be able to treat your patients. So this gives you, and you will see when you use it, an amazing power of traction that you cannot find with other threads. The second part of our patent is based on the shape of the cogs. So obviously the tip is rounded, so you are not hurting the tissue. It is not like a spine. But what is very different with other products, for instance, spring thread is not like this. The shape here is conical, like this. It means that this part is larger than this part. Okay, so it makes the cogs much more stronger, much more difficult to push backwards. If you want to push backward, only one cog on 800, you need to put 1.5 kilograms of pressure. It will never happen in the face, which is weighing 60 grams or 70 grams. So this is very, very powerful. And because of this technology, this is not cylindrical, this is conical, it makes the cogs much more powerful. So that's also the reason why you need to learn how to use it. It will not be a big deal for you. It will not be complicated to learn about it, but you need to understand that using correctly this device and achieving full potential is a lot of slight details. A lot of details regarding the layer, regarding the vector. So it's not difficult to learn. It's just this is a sum of a lot of little details that will make the difference between average results and amazing results. This is a better view, so you can see the rotation between here and here. So every row is rotated 45 degrees. I think you can see it also very well on the 3D the 3D maquette on your tables. So why did we decide to use polyester, PET, and silicone? I think that's a question that Dr. Gupta and Dr. Cravero already answered this morning, but I will try to give you even more details. So first of all, when we created Infinithread, as I told you, the idea was to keep what is good and to improve what is not good on other threads. PET used for art suture for 60 or 70 years. Solid medical grade silicone is the gold standard for a lot of implants. So we did not want to reinvent the wheel. We did not want to reinvent something new. We wanted to give biomaterials that already have a lot of insight. Everybody knows about their reaction. So we stay in a good area where we know all the product and all the biomaterial will react. Spring threads, for some that maybe, I don't know if you know spring thread or not, this is another permanent thread, maybe the only one on the market. It is made by the same biomaterials. There is no difference. The difference is in the design. So spring thread is elastic, all threads are non-elastic. The elasticity, polyethylene is not elastic. So how can you have a thread made of polyethylene, terephthalate, and silicone elastic when polyethylene is not elastic? This is a design thing. In the silicone of spring threads, you have the polyester going like this, like an helix. So basically, when you pull the extremity of the thread, it's not the polyethylene which is elastic, it's just that it's lengthening. It's going longer because you have more polyester inside the silicone. And as the silicone is flexible, is elastic, then the silicone will come like this, and when you pull, it's going like this because it is elastic. And so the polyester is gaining back this shape in between. So that's why they are elastic and we're not. And that's why they manage to be elastic. But this is all opinion, obviously. They might disagree. But the elasticity for us is not a good particularity because, in our opinion, elasticity is something that will make the thread a little bit longer after. So as I was telling you, in our opinion, elasticity will make the thread a little bit longer after a few years. And if you have like 10% or 50% of thread longer, then you lose the result. So on the long term, in our opinion, elasticity is not a good feature. So a lot of experience, no problem if you do any exam. So I heard about the questions regarding can I do a facelift after? No problem. If you want to do a facelift after 10 years, 5 years, then you can decide if you want to use the threads to help your facelift because the thread will be intact, or if you want to remove the thread and just do your facelift. And the fibrosis is also minimum. So fibrosis around silicone is 10 microns, 0.01 millimeter. Fibrosis around polyester is 0.01 also. So fibrosis is very low. We have a published article on 9 years follow-up of the product, which shows that the fibrosis stay very neutral over time. I will go quick on this. So those are the treated areas. So you can treat eyebrow, face, and neck. I was hearing this morning question about breasts, question about the nose. So as I told you, we are very transparent. We are working on those areas right now. For the nose, we did a lot of tests. We are not completely satisfied with the result. We have very beautiful results, but it depends on the patient. So we are continuing to work on the techniques. And when it will be ready, we will show you. And for the breast, it is off-label right now because the thread is CE marked for face and neck. And so we are working with the biggest leader of the implant on the market right now to work together to create a solution for mastopexy. So this is ongoing, but not yet already. Those are the technique, different kind of techniques. You can use threads alone in a medical way like this. So you are not doing an incision, you are not doing general anesthesia, you are not opening, you are not undermining. There are several ways of using the threads. This is also something, this is the reason why we do advanced workshop in France or other places to show you how to really use a different technique. So this will be very useful to treat the hunger here. This will be very useful for the jawline and for the gonion. This is very useful for the vertical line. So there are a lot of techniques. And we will show you, we will give you access to a lot of videos so that you can see that. Or you can use it in combination with surgery. So that's what I was telling you. You can use it in combination with surgery in the undermined area. So this way you have a less invasive facelift. The benefits is reduce undermining, improve elevation of the tissue, and having a longer durability of the results. Because when you do a facelift, all the facelift is here, right? The suture is the important point. The suture is catching everything. So when your suture is starting to tear apart, then your facelift is going down. So if you put threads, then you have the power of the threads and the regulation of the weight is on all the cogs of the threads, so it gives you better results. I will finish on this and some pictures. So it's very important to understand also that InfiniThread is a removal device. You are not married with the device, your patient is not married with the thread. If for any reason your patient wants to remove the threads, or if you want yourself to remove the threads because you put it too much superficial or for any reason, you will always be able to do so. There is a protocol, there is a way to do it, but it is removable. And when we say removable, we mean without scar, without sequelae, without letting silicone inside, so that was the question of this morning, and without time limit. Because the thread is not inflammatory, because it will not create a large fibrosis, if you remove it after 10 years, it will be much more difficult than after 6 months. The only thing is, if you want to remove a thread that was implanted for a long time, there's a protocol. You need to do hydrodissection because the thread is catching the tissue. And so you need to, as when you do a liposuction, you need to do hydrodissection just to free a little bit the tissue on the threads, and then you will be able to remove it. Also, the thread is purple for this reason. We created it in purple color because it's easier to find it. Because the white threads or transparent threads will become yellowish or orange, and so it will be difficult to know if you are catching a ligament or something. With the purple threads, it is invisible under the skin, but when you open and you want to catch it, then you see it immediately. Way easier for you. As I told you, our mindset is, how can we help you to use it and to have easy life? The thread is not moving, so if you have operated your patient, you have the operative reports, you will find the thread exactly at the same place where you implanted the thread years before. And if you have no idea where's the thread, you can use ultrasound, because the thread is visible to ultrasound. So you don't need to do exploratory surgery to find the threads. Using ultrasound is fine. The thread is very resistant, so as I told you, the thread resists to 20 newtons. 20 newtons means 2 kilograms. The usual post-op, but I will not go on this because they are already discussed that this morning, but edema is the usual one, and low pain treated by analgesics, nothing else. Picture of results, so I will finish by this. So this is a 4 years result. So it's important to tell you that on all pictures there is no fillers, nothing, just the threads. So sometimes you might say, I can do better. Yes, you can do better if you mix different interventions, if you do fillers and then you will do laser for the skin. Me, what I want to show you is what the threads can produce as a result. Because if I show you patients which have different interventions, then how can you know exactly what part of the result is due to the threads? So those are threads only. So it's a 4 year patients after 4 years. So if you want to analyze correctly a picture of threads, because you are pulling up the fatty tissue and the skin, then you need to check first the shape of the external cheekbones. Then you can see the difference. And obviously, the jawline, the nasolabial fold, and the Villiers line. So it's a 4 years. This is a patient after 3 years. Of course, she didn't have a lot of needs. She already was good, but you will see that the threads make her no aging. Look, after 3 years, same patient after 6 years, same patient after 7 years. So if she didn't have threads, tissue would go down, obviously. Patients after 2 years. So those are European patients. So maybe not the same standard that you would like to achieve, but as I told you before, the thread is very powerful. So if you want to create bigger cheekbones, you can do it. It depends on what your patient wants. And when I go to Saudi Arabia, I'm not showing this kind of pictures because they are telling me, where's the results? I want big cheekbones, I want to be Kim Kardashian. Say, okay, French lady, they want nobody to know they did something. It's very different. As Dr. Gupta said, very interesting this morning, he said that one patient was very unhappy because his family asked, what did you do? I can see something. And a lot of patients we have patients that doesn't say to their husband they are doing something. So that's interesting. Okay, 2 years, another one after 1 year. Okay, I will pass on this. For the men, you can have nice results. Obviously, this gentleman wanted just this to be fixed. This is another patient. So we did the eyebrow, we did the face. This is some neck result with a single thread, single crossing thread. Another patient for neck. Okay. So this I will pass. Those are the different things you can find in our boxes, but I think we can talk about this. And finally, the certifying course. So basically, our courses, as I told you, are individual and in 3 steps. So this is Vikas who will deal with this, or the team of Vikas here. So basically, we'll have theoretical courses that will go deep into everything about the product. And then there is a workshop, so training can be done here or it can be done abroad. This is something you can see in direct with Aesthetic Zone. So this will gonna be a live course with live patients. And then there is the last step, which is a follow-up with the nurse, somebody that can come to your place to support you when you use the products. Because it's very important for us that you are going through a very quiet and very smooth learning curve. We know that it's a lot of trust, and we thank you to start using a new device. We thank you very much for this, for the ones that will decide to try it. And we know that you can have great results with other things, surgery and things like that. So you want to have a good time when you start using our product. And that's the reason why we have so much services for you. And also, the biggest one, in my opinion, is the support by a qualified nurse to help you the first time you're using the product. When you reach the community of Infinitrade users in the world, you're gonna have access to what we call the masterclass by Tradenlift. So you're gonna have access to a private area on our website where you can download more than 60 or 50 or 60 documents. So all the protocols, information sheets for your patients, prescription templates, informed consent template, everything is ready. You just have to fine-tune it for India and for your patients. And you also have a lot of replay of webinars, technical videos, a lot of things like this. You also have a welcome package. So it means that you will receive some, I think, a little bit less bigger than this big purple thing, but to put on your desk. You will have a lot of things. You will have an official diploma because you are certified and you will be registered on our website also as an official certified practitioner. And then you will enter a community also of 800 certified surgeons in more than 25 countries. And we have a WhatsApp group with more than 250 or 60 surgeons on it, international WhatsApp group. And where you can ask questions, you can share your results, you can see lots of knowledge shared with other surgeons. And this is what we want to give you. You will not be alone in your practice, you will be part of the big community. And we have a lot of tools to help you, and we can offer workshops, a lot of things, even live workshops in French, for instance, if you want to be more specialized in the neck, we have this. And we are always open to your feedback. So if you need something, is there something that you want us to do for you, then we will do it. Okay, thank you so much. Thank you very much. Sorry for everybody.
In 2 days, it's going to be 6 to 3 days. Then you connect, and then when you are connected, then you can click on the sync. That's the only way to do it. So.
Sounds good. आप इसमें भी sounds good.
So this is live intervention, I believe, from the clinic of Dr. Buka. So I don't think you can hear us, right? Not yet. Okay. Okay. So if you have any questions, maybe I can answer some, or Dr. Pravio, or if you have questions regarding what I asked, what I said before, so please feel free to ask. So on this patient, Dr. Luca is doing 3 threads. So as a 3 threads for the face and 1 more for the jawline and the gonium here in the L shape. So I would say that this one is rather to define the angle and create a contrast here, and those 3 are to treat the face. So obviously I can guess that there are some economics components in the choice of doing 3 threads here. As you can see in our techniques, most of them are 4 threads on each side. This is because we believe that with 4 and 4 you will get better results. But obviously, if your patients cannot afford it, or you feel that the patients only need maybe the upper part of the face, then you can reduce the number of threads. It's up to you. So on this lady, definitely decided to put 3 threads for the face.
For example, sometimes I use 3 threads for zygomatic for the mid face, because I want 1 thread more close to the orbital rim to push if I have a malar bound, I want to catch the breast muscle, and sometimes when I have thick tissue and thick tissue, I mean also a big marionette area. So I can catch with 3 threads, I can catch all the tissue in the marionette area. Okay, and so I use also another thread for the marionette, but it's not so important for me this one, because we have some more difficulties to stretch as much as we can, while in the central part of the zygomatic area we can stretch as much as we can and obtain a good push of this area. So sometimes I use 5 threads for the one side of the face, and this is I use for example 2 threads under the muscle, under the platysma, and these threads I use for the subcutaneous tissue to improve the cervical, the mandibular angle. So as I said before to some of you, the SMAS in the face is one thing, the SMAS in the neck is a completely different thing. So the SMAS in the face is just like a subcutaneous tissue, just a little more full of fibrous tissue. The SMAS in the neck is muscle. So sometimes I use 2 threads for the neck under the platysma muscle, and I had poor results because of the fact that the subcutaneous tissue slides in the plane of the muscle. So the threads were positioned correctly under the muscle, but I had to improve my result with an additional thread in the subcutaneous tissue, that is that one.
So why the J-shaped marking? Why the J-shaped marking? Why not a straight line? The marking.
Yeah.
It's marking like a J, why not straight?
The marking here or the marking? This marking you will see is just a little different from my markings. I use the original marking because in my hands is the convex line permits a more generous traction and more linear traction. But there are lots of there are surgeons that exit and re-enter. There is also for example, you could see in the section of the surgery approach of different surgeons in the web. There is also the W design, the W drone. Everyone choose according to his sensibility.
The goal of, if you go straight, the thing is the place where you're gonna have the most edema when you do threads are the tip of the threads, because this is where your needle is going out. This is where you exit. This is where you create the more inflammation. This is where you're gonna have the more edema. So even though after 3 to 5 days, the edema is not visible anymore, the patients maybe can see because the patient knows her face and she will look in the mirror 10 times a day. But your friends will not know that you have edema. But still, you still have a little bit of edema. So for a few weeks, you might have some edema. And so if you go straight, there is a risk because of this specific area at the extremity that a little bit, some tissues may be unhooked by the threads. So they can go out of the hooking of the cogs of the threads. So if you go straight, you have bigger risk to lose a little bit of the effect at the extremity because you have too much liquid. And so if you're moving, you do a mimic, maybe the threads might unhook a little bit some tissue. If you're doing this shape, whatever, it is a V or it is a J, some people they prefer a V because they have a stronger effect at the tip of the V. Some people like Dr. Kramer, they prefer to have a convex shape with J. Whatever, the goal is that if you have a thread coming upward a little bit, this way, then you avoid the risk of losing the catching of the tissue at the extremity because of the edema. So this JV things is very useful for the few days, few weeks. After a few weeks, when there is no more edema, it doesn't change anything. You're straight on it, but you did not lose the result during the edema period. That's why you can see this JV things.
According to me, there is also another question. If you don't use different vectors with a curve, with a V, sometimes you can't stretch as much as you want because you have just one direction. You could remove the threads.
I think we saw that already. Don't know. I don't know if it's labor, I should say. Yeah. And so also in the technique of Dr. Cabello, you saw that he's going very deep. And there's also different philosophies for other users that will go much more superficially just to catch the skin. It's a different approach than for the face. For the face, there is no questions. You need to go deep in the mobile mass, otherwise you will not have good results. So you definitely need to, for those threads, to be deeper. But for the face, for the neck thread, some surgeons, they will not fight against the platysma. So because you are cutting the band, it makes a lot of sense. But if you don't want to do it, then being superficial, you can recreate an angle just because you will have this crisscross of threads here. So when you pull, and you will not pull strongly. For the face, you pull very strongly because you are anti-gravitational. So you want to pull up the tissue. For the neck, what you can do is by being superficial here, very superficial, and crossing your threads, by just exerting a little bit of tension here, you will pull backward the skin, and then you will recreate the angle. So that's also another solution, and that's what you said a little bit like by combining superficial threads and more deeper threads. So what we like the most in the world is when we have surgeons exploring new technique, doing different things. So there is not, the idea is that we are not telling you, if you want to be successful, you need to use a product like this. We are telling you, those are techniques, we have a lot of experience, we know that this is working. But if you want to develop your own way of approach, that's going to be amazing.
Why you have delegated on the JMM? Why you didn't do it straight? Yes. Yes, we have a display the procedure. Light will be there and voice will be from this side.
Do you have any question or anything during the lag of the video? If you have any questions, please feel free. Yes. Yeah, no problem. I'm just using the time now. Regarding the price for patients, sometimes it's a question we have. How do you position the products in terms of price? So there are two ways of doing things. I don't know how you're doing it, but like the feedback we have from all users is, in average, what you can see is people positioning this thread lift 20-25% less expensive than surgical facelift. This is the average way of doing things. But I must say that the people that are using the most the threads, they have a different philosophy. They are sometimes selling it more expensive than the facelift. Because your patient is trusting you. You have a big leverage on your patient. She's coming to see you to ask your professional advice. So it depends if you are comfortable or not. If you are uncomfortable to offer the thread lift, infinite thread, patients will feel it and she will not do it. If you are very confident, and a lot of surgeons, they are working with us for many years, so of course they're going through the learning curve. They were not doing this the first time to use the product. But right now what you say, okay, I can give you this result with surgical facelift, or I can give you this result with infinite thread. If you choose surgical facelift, you have general anesthesia with the wrist, you have the downtime of the facelift, it is not reversible, and you have the scar behind the head. So it's less expensive because you have rest and downtime. If you use infinite thread, it's going to be more expensive because it is mini-invasive, you have less risk for the same results. And because this is all about psychology, human psychology, the patients will say, I will take this one because it's more expensive, might be better, and also I understand the thing that surgery might be more tricky for me. So I'm not telling you to put this higher than surgery. I mean that this is all about your trust. If you trust the product and if you trust yourself when you're offering it during consultations, it's going to be much more easier to have a patient that trusts you and also accept to do this procedure. If you decide to sell it at the same price as absorbable threads, that would be a big mistake because the value, the perceived value of the product will be terribly low. And then you will go back to the whole universe of this is just one more thread, and I know that threads are not good and stuff like that. So you need to position it as a premium product, which is what it is. So yeah, I don't know your opinion about that. You belong to which?
I belong to the second
Yeah.
population of
Yeah.
surgeons.
Of course.
Of course.
Yeah.
Let's have a coffee break.
Yes.
He said he uses one of his trades, superficial, the superficial pain, subcutaneous pain for the neck. That's right, Dr. Lupu?
Yes. Superficial for the neck.
Superficial for the neck. So does it become palpable because the neck skin is usually very thin?
No, no, you cannot feel it. If you pull it, yes, you can palpate it.
Subcutaneous, if you're putting yes.
Yes, if you pull it here, I can let you answer this. But,
I think you can touch sometimes when we cross each other. There is a little point of palpability, not just in the crossing point.
otherwise, you don't have. You don't feel it. You don't see it. Even if you are superficial. You actually, the thing is, when you put your needle, to know in which layer you are. When you put your needle, because you will implant the needle first. It's a 19 centimeter long needle, as you can see in the videos, and then you pass the threads in the eye of the needle. So
No.
this is the needle. Live, okay. I will come back to you.
It is the J technique which is done. So what I do, I show both. What is the convention, what I do, and then of course you can choose which one is best for you. So what I do is I pass the needle backwards. I hook the angle of the mandible and turn the needle in front. The convention is to go like this. So I found that by doing that, I'm able to take a bit of the neck up and I'm able to define the angle of the mandible a little better. So it's a choice, something which I've started doing and I feel I get better results, a better jawline. But the conventional technique is probably as good. So I'll show you the difference between both besides. You just take a few minutes to start, starting with sedation, cleaning the face. Once you've done all the breathing, just to show privacy. So I don't want to Just give me a minute or so. If there's any other questions, please ask. So we've got the screen on our TV. And because from the phone, we can hear you. So we'll be putting the audio on mute from our side. So we don't want any chatter to reach there. If there's any question or something, just let Vikas know and I'll unmute myself. विकास आवाज आ रही है हम तक विकास आवाज आ रही है
आज तो कर रही है
Am I audible to everyone?
Yes.
Should bring us to the page of the video as well. Great, thank you.
We've been discussing that.
Am I audible?
Yes, yes.
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 Vikas? आवाज आ रही है मेरी यहाँ पे?
जी तो थोड़े में
So the question about the angle of the jaw, the conventional one is the one that I have marked as one. The needle goes like this, goes like this. I go back and in front, so this also gets pulled up. So that's why I like to do this and pull it.
You can do local anesthesia or sedation, it depends on what you prefer. The only thing is, when you do sedation, the thing that might be a little bit tricky is that at the end, you want your patient to be seated because you want the gravity weight, to fix the tension of the thread. So that's the only most you can see. The good thing is that you don't need to talk to your patient. So yeah, in different of the countries, like in Turkey, they will never do local anesthesia. Like they don't want complaining patients or saying that the local anesthesia, they don't like it. So they do full sedation. In other countries, patient doesn't want sedation at all. So like in France,
It's gonna be local 100%. No sedation. The only case where they will do it is, or general anesthesia is they combine with surgery. But if they only do threads, it's gonna be 100% local. So it really depends on what you prefer. And can be a little bit quicker, obviously, with sedation. You don't need to do all of this local infiltration.
But remember what I said this morning, if you put an excessive amount of local anesthesia, you could lose in the following days the power of these threads.
The anesthesia is something you don't like because you think that you are wasting your time, and I can understand that. But that's, I think, the biggest mistake that we can see with surgeons starting to use our product. They don't like to do it, so sometimes they are not putting enough anesthesia because they want to save time. So the patient is complaining and you are having a hard time. It's not good. Or sometimes they are doing too much anesthesia because, say, they want to go too quick. But then you have too much volume, so you don't know where you put your thread, you don't know which part of the volume is due to the repositioning of the fat and which part is due to the injection. So you need to be a little bit careful of the volume, and that's why we have protocols. For instance, you will find this online. We have 30 pages protocol that sum up every gesture for face, for neck, for everything, with the volume that we recommend to use for the anesthesia, and the mix that we recommend to use for the exit points and everything. the cannula you can see that is using is a 90 millimeter cannula. This is in the box with the threads, as well as the 50 millimeter cannula that will be used for other parts of the threads. So both are in the box with the 8 threads, as well as the pre-roll needle that you are using to punch before entering the cannula. For the rest of the instruments, stainless steel needles and everything, those comes apart in kits of instruments, and they are all reusable and reserializable.
Would you have a sample there for us to feel here?
I don't know.
Or a kit box that we can see so to speak?
See, I'm very.
You had it on the slides, you ran over it fast. You had the slides of your kit, the box.
Yes.
You had that in your presentation.
I have.
Presentation, you had that box and it's like.
Yeah.
Yeah, it's not very
Oh, but you want to touch the
Thread. Yeah. So,
Right. Yes. You have the sample of thread. You have the sample of thread.
Sample, right?
You don't have.
no. Unfortunately.
What is the size of the needle that you use?
The length or the diameter? It's the same that for the thread, so it's gonna be 1.4 millimeters.
Something like that.
Yes. The needle to implant, they're gonna be outside in a sterile instrument kit. Yes.
While you are like utilizing the wire in the wrong plane, can you remove it at the same time and reuse the?
Yes, absolutely.
Of course.
Absolutely, yeah. It's gonna be very easy because you did your local anesthesia, so.
So the thread doesn't get damaged.
No, absolutely not.
It could be a damage if you remove from the exit point, pay attention. But from the entry point, it's not possible because you are in the temporal area, or in this case, maybe in this area. But from the exit point, you could damage the skin.
So you take it out from the exit point.
So
Entry point.
from the entry point in the temporal area, because it's a safe area to remove.
Audio, ready? So we're starting with the face. We have a bit of a challenge with the neck infiltration. So just giving a bit more relation to that. Meanwhile, we'll start the face. So this is the needle that we use. We can curve it the amount that we need. So if you want it straight, you can straighten it or curve it. This angle is determined by the marking that we have. So if you could focus. For example, I need this to reach here. So the needle is reaching this and I just bend it a little bit more. Now it's more in line with the marking. The second one is also okay. Third one is also okay, otherwise I can use a different view and just turn it. For the fourth one is also okay. If I have to go like this, and I'll show you how. So the first point that we do, we go vertical as you heard in the morning. We never go horizontal. This needle is held with the needle holder. The needle holder is on the inside of the needle. It's not outside like this. Always inside. Take the ergonomics of your body, shoulder, elbow, wrist. They should be relaxed. Support the needle with this, like this. And then just enter vertical. Yes. So I could feel a slight break of resistance. Then I go horizontal and I pull. You can already see the pull is okay, so that means the needle is in the correct plane. My shoulder is fine, my elbow is fine, my wrist is not like this. The problem postures are this, or the most important, that your finger presses the needle inwards because you are straining to go in. If you press this inwards and this is fixed in the tissue, the needle gets like this. So this is just to support, not to push. Very often this will happen in your initial times that you will end up pushing this and it goes like this. Be very careful of that. No pressure on this index finger. Go again and go deep, go horizontal. Keep checking this, following this line. Now I have to go deep. Just I turn my hand so that the tip of the needle goes downwards and just push a little bit. From now I start feeding the tissues onto the needle. At all points, I have to see if I'm pulling the tissues or not. So we can clearly see the fat is being pulled up, not only being pulled vertically, it's also being pulled towards the under eye region. See, this hollowness of it is getting corrected. Keep going in. And here, and so I'm going to ask Nandini to just feel all along to see if there is any difference in the weight, the thickness of the tissue. As long as it's uniform, it's fine. Now, because I need to make a sharp angle, obviously the needle can't move. So what do? I hold it here and I push the tissues here. Now the most important point, you exit. What I do? I go down and I come. That's all. Now we're going to feed the head. The next point about the direction of the exit. So the circular motion. So just focus on that particular zoom कीजिएगा. This black point here is the midpoint. So this has to enter. So this is where we stop. Now, during our discussion with the patient, she wanted a bit of an iceberg movement. So normally we go here, as you would have seen in the morning, but I will go a little more anterior. What I'll do? Is a different. This is a straight needle because now I don't need curve. You can hold it with a needle holder. I'm not used to this. I just use my finger. Just do a bit of traction, enter the opening, go in a zigzag manner to engage the tissues. And just exit out. The first phase is this. At this point, we check if any hair has entered the opening by mistake. So we will pull any hair out, we seal out everything, and the next step, once we have taken the hair out, we will just rotate our instrument inside to ensure that there is no hair. So the next one. So again, same movement. Only thing is because this is we are going lateral, so I have to shift here as well. If I stand here, there's no way I can get a layer. So I get my body in the correct position. I go vertical again, and then I turn over.
You go vertical at first because you don't want to catch the dermis and create a fold. That's why you're not putting your needle like this, you're doing like this and then you move.
And the scalp is subcutaneous.
As I go towards the exit, I just turn down. You can see this dermis is going down. That means I have got it wrong. I just shift back a little bit. Can you see the dermis movement? You just shift back. Okay. Go back. I go more deep. You turn down. Nice. Again, very important that we move the needle in a circular direction, not like this, like this. Now, I can do the, so I'm going to now put the third thread in. What I started doing is I put all the anterior part and then I put the posterior part. Again, vertical.
Yes.
Superficial deposit, understand? There's a superficial deposit. This area. This superficial deposit.
To check where your needle is, easiest way is just to turn it up and feel it. When you take it up, you know where it is.
Technical moment in which you want to be just when you finish this maneuver, I will ask to explain as you said when you prefer to put in the start, if in the superplano space or under the superficial fashion. I will ask you. Okay, now ask. Dr. Amit, can we ask you two questions? No? I don't think he has the audio. I think that now the maneuver was to enter.
I have one question, Dr. Lucas, to you.
Yeah.
Can we, once you have inserted a thread, suppose you, after inserting, you think it is in wrong plane, can we take out the thread and again reinsert it?
Yes, of course. Yes, of course.
So I'm doing the fourth thread and showing the relation between the two.
Are you hearing me, Dr. Amit?
If you think it is in wrong plane, then can we remove the thread? From which side we have to remove? From the entry side or the exit side we have to remove? Pull it from the entry side we have to remove.
So if that is the case, for example, you put a thread and you don't want it to dipole or something, you're not happy with it. All you have to do is just pull it back from the entry point. Yes, yes. So I put the four fingers in the conventional direction. Now, now we just change this. So we need to now get a better angle. Go deep inside. Instead of this direction, it's this direction. I reach this point which I have marked. This, then I turn my needle, then I go at this. So, in fact, if you can see, it's already
lifted up because of the angle. And sometimes I even just go slightly below the mandible just to pick up the full of the skin.
Is it deep here or is it?
This is so this.
So looking very deep, no? Is it?
So that somebody had asked me why I'm marking that way. Again, it's a choice. I think I get better results that way, but
Is it solution or deep?
after this, I just put
Looking
the
deep, but we had said solution.
material,
Yeah.
we move on to the other side.
Except the individual job is a little different.
So the fourth one is now I'll quickly work on the superior aspect of it.
Is it bunching, more bunching? Where can there are cash? Again, 90 degrees. You start from the. Like the general 60 degree.
Nothing comes in. Yeah. For the men, it's exceptional, but sometimes so.
Rather than 90 degree, there's a. What about some people that you fear? Obviously, you can ask them to shave and come, but they don't want to shave, then can maybe the people are going to shave the thing.
Yeah, yes, you can.
It's like you can't, yeah, like, they can't shave, they're not allowed to shave.
I don't understand. Yeah. It's okay.
Only if you shave it.
Depends on the bird.
So this side was so the right side was the easy side. Now going to the left side, we're going to use the left hand. I don't tighten anything here. At this stage, though we can clean the face if we want. There's a slight dimple here which will correct when we are removing the face. So mark my left hand. Vertical, horizontal, chest, knee, chest,
It's
In the pipe. I think the cost will increase.
the thing is the entry point
Okay, you come. Here it has to be exit. Because here you're going back. From here also has to be vertical.
Sit and repeat slowly.
Putting the cannula here, when you're exiting here,
I put the cannula here, I exit here, yes.
so should it be vertical exit or a horizontal exit?
No, it's, I don't know sometimes, but the right exit point is exactly vertical to the skin.
Yes.
So, he doesn't use the left hand. I always use the
The
left
left
hand.
hand more.
You have to use the left hand much more. Because you do this, you the exit point is completely
Vertical. So that there is no puckering.
Eh?
There is no
No,
puckering.
because it has just
Right.
because it doesn't use vertical exit.
Thank you. There is a natural differential here. Even before I put the thread. When we put the thread, this is a little bit deeper. I'm not worried about this.
They call it non-contact. But to be very honest, who's there? There is no anchorage. We take a stitch and take the qualification. Now, unfortunately,
Way of better.
so we could street go on the side, ride a lot. That's when the ladies try to put differential, three differential orders.
Always margin.
How do you avoid the parotid? What are the trips for?
It's the most important to avoid the parotid. You don't release, but release the left hand.
Okay.
So you are above the parotid because the parotid can move the left hand. The parotid is firm under.
Yeah.
You remove all the soft
Soft tissue. Left leg and then.
So,
So you're not holding the parotid and then go.
you go above the parotid
also 2 millimeters, 1 millimeter above the carotid, you are really without any problem because you can remove the carotid with the left hand.
And you don't
It's
use
impossible.
any ultrasound, nothing.
No, there is a new ultrasound that is sterilized with, and you can use with the one finger, but
Anybody has anything to ask, please ask him.
This whole,
but don't underestimate the power of the left hand.
yeah.
Another 6th straight, 7th and 8th, another 2 bowlers. Then we start.
It's impossible. If it's counted, you
You do all the typing right at the end.
Yes. You will do it. I said impossible. Not maybe you, but less or soon or later you will do it. But with the left hand, you can.
What is the worst complication you've seen? Worst complication. Not in your hand, somebody
Worst
else's hand.
complications is piece of an artery